So looking back, are there anything that jumps out in terms of like, here's why we succeeded so well, or sort of the lessons learned, right? Anything you take away now and reflecting back, and obviously also going forward now, right? Just sort of, hey, this is what helped us get there. It really got us over the hump, or here's some things that I might do a little bit differently, or just as people are thinking outside now, hearing your story, right? So I'm sure you're going to get phone calls of people saying you did what, right? And how did you get this done?
I think using the data, find the data and then use the data to your advantage. Um, I am in a very antiquated EHR system, and so it was a very manual process for me. But once I was able to find the data, to use that data to my advantage. And then communication with the providers, communication with the patients, and then, communication with senior leadership in the C-suite on, you know, historically people think of screening exams as very low generating revenue, but then showing them that the paths that we are creating down the road. So whether it's follow-up CT scans because there was pulmonary nodules identified, or referrals to cardiology, echocardiograms, you know, referrals to oncology. So we could show those pathways that we created with the screening exam for future revenue and for
That's right.
more higher volume studies.
That's right. And I think also, and I'm sure you can validate what I'm going to say here too, is you create another level of trust with the community as well. And they actually see you as their partner in their healthcare journey, right? And, yeah, it's nerve-wracking to go in, but oftentimes you screen, you catch things early, and you can change the outcomes of, all sorts of things that are going on, right, in the community. So,
Absolutely. We had one CT low dose lung cancer screening, 100% asymptomatic patient, had nothing. There was something suspicious. That patient was referred to a surgeon, and the surgeon questioned, how did this exam even come about? And she was like, my clinic screens for it. And he goes, that exam saved your life. And so I was like, yes, that's why we did it.
that's right. And you're like, and there it is. Forget the money, forget the dollars. All it takes is
Yep.
that one. And it's amazing, right? The power of just that one example. And you probably have many more of those you're not even aware of that are happening now as the program is kind of sustained and rolling forward. So I know that's fantastic. Now, what about the teams? Like, I'm so curious. Do you do things now to celebrate with the teams? Are they understanding the impact they're having? Are they still bouncing ideas around of things they can do differently or to create enhancing it? Are you still going out to the schools and the community and promoting and all of those things?
Absolutely. They
Yeah.
are all on board. I have the best team. I would put them up against anybody. They are all about it and they are all for it, especially when they identify something and they're like, we got it. We got it
Yeah.
before it became a problem. And so I would absolutely, their enthusiasm is very infectious. They bought into my crazy ideas over and over again. And so I could not do what I do if I did not have this team. We would never have been this successful. They were all absolutely on board.
Yeah, that's great. I mean, we always say that's the key, and it sounds easy to say, hey, get your teams involved, but when you can unify around something simple and start to see results, and it gets people into why they came to take care of these patients in the first place, right? And just getting people to understand what you have available and getting them in. I love that. Now, also, I imagine you worked with the radiologists as well. Did you have a partner on that side? Do you have like contract radiologists, employed radiologists, or strong partners there? Are they heavily involved with you?
We have a contracted radiologist,
Mhm.
and so he was absolutely involved. But because of, or partly because of this project, we have been able to bring a radiologist in-house. And so that will be happening in a
Really?
few months. And that will allow us to expand our screening mammograms now to do diagnostic mammograms. And eventually, we're looking at doing our own biopsies so that we're not having to refer those patients out.
Got
So
it.
now
Got it.
we're
Got
going
it.
to be growing that program. But,
Right.
we had to have the data, we had to have the numbers to show that this was the next right step.
That's right. That's interesting. So okay, so originally then the screening program, you'd find, identify stuff, and refer them elsewhere. Now you're actually generating enough volume where the system can keep it in, keep it even more local, reduce the travel for folks, and go that route. And then you get radiologists who want to come and want to be part of that.